Members of Congress, fellow DIPG advocates, and the Biden administration, a warm welcome and good morning to you. My task today is to present to you the challenges we've had in accessing a very deep central part of the brain called the brainstem. The brainstem, a very deep-seated area of the brain, does not allow most chemotherapeutic agents to penetrate. In this plot on the left, this shows you the disparity between what's in the bloodstream and what actually gets to our target tissue called the pons, circled in red. On the right, one of the answers to that has been to escalate doses of chemotherapy at the detriment of patients. 1 in 5 toxic deaths just from chemotherapy when using these types of dose escalation formats. The discovery in DIPG, as you're going to hear today and you already have heard, has been phenomenal in the past 5 to 10 years, an outpouring of information that now allows us, from the standpoint of therapeutics, to look for drugs that are potentially efficacious. This is a sampling of some prominent publications addressing just this issue. What therapeutic agents can we utilize in this disease? Circled in red are those types of agents. What's important to understand in that central figure, these are large molecules, not large based on what your perspective might be, but as far as getting from the bloodstream into the target tissue, almost an absolute no. My laboratory has been focusing on ways to obviate that problem called the blood-brain barrier and not letting these very effective therapeutic agents get into the DIPG cancer. Depicted here on this slide is a young girl who we treated many years ago in one of our clinical trials. And I show this from the standpoint of motivation. Why invest the time, the effort, and the money? Yes, to help these kids in dire need, but also this sense of desperation by the families, by the children, is overpowering from the standpoint of the need to find solutions. On the left, that video demonstrates the problem. These Y-shaped molecules in the cartoon of the capillary blood vessel in the brain doesn't allow these molecules, these therapeutic molecules, to gain entrance into the cancer tissue. A logical solution, bypass the blood-brain barrier by putting these small cannula or catheters into the tissue and infuse that therapeutic molecule. So simple in concept, very difficult in practical terms. On the right is an illustration depicting what would have to happen. We would have to pass a small bore catheter somewhere outside the skull into the target tissue in the centralmost part of the brain called the brainstem and infuse these large therapeutic molecules. Rarely ever been done prior to embarking on this clinical trial. So the long road to proving safety and feasibility has been costly, time-consuming, and a whirlwind of scientific progress. This is a sample of that 10-year continuum from concept to the actual implementation of a clinical trial through a very invested staff in the laboratory. Going outside the norms, this adventurism, doing something that has never been done before, taking on risk in the therapeutic world. Caitlin, whose mother brought her up from Florida back in 2012, would be the first to enter onto this very innovative therapeutic trial. The bravado and the sense of confidence built in these families and the desperation I can't emphasize enough. Mother would sign consent for something that's never been done before for her young child, her budding cheerleader. 6 years later, we published our preliminary results from the standpoint of this concept of putting drugs in a particular location and avoiding the bloodstream and all the toxic byproducts thereof. The phenomenal aspect of that, the results have been that we could do this, and we could do this safely, repeatedly, over years in many kids. The second most prominent aspect of this is that we could enrich the tumor tissue with 1,000 times greater drug concentration than you would see anywhere in the bloodstream. A phenomenal jump forward, proof of principle. Furthering that, and we're about to report at this upcoming International Society of Pediatric Neuro-Oncology in Germany next month, the long-term survivors, the anecdotal, the few but real kids. We've seen it. We've seen this anecdotally. This is encouraging from the standpoint of harnessing this very, very powerful drug delivery capacity. This is not limited to direct infusion through these small cannulas. The innovative front of what we're seeing on the neurosurgical and neurointerventional front is huge with regard to minimally invasive and non-invasive substrates and platforms for getting drugs where we want. Focused ultrasound, convection-enhanced delivery, intra-arterial delivery. These are building blocks to achieve the same goal, and we're exploring those very vigorously. And at Weill, Cornell, and the Children's Brain Tumor Project, we're heavily investing in the application on the clinical side of harnessing these tools to provide a very basic building block in the cure of this disease, and that's drug delivery. So as a child, my heroes, Armstrong, Collins, and Aldrin, I couldn't escape that phenomenal aspect of accomplishing something that was beyond expectation or even belief. When I became a father, this was a reference textbook at night to demonstrate to my kids the power of defiance and perseverance and continued belief in what you may have and pushing that forward as a platform. The hidden message there was the fact that the Apollo 11 mission cost over $25 billion. And I'm sure Neil Armstrong, whose child died of this disease, would have been flummoxed by the idea of investing a fraction of that in the cure of his child. This is no stranger to anybody involved in clinical trials in cancer, as you can see on this plot on the right. What this demonstrates is the small cost of the concept evolution, the increasing cost, the logarithmic increase in cost to take this into a safety study, then into an efficacy study, and then demonstrating how this might be proven better than what is considered to be standard of care. Tens and tens of millions of dollars. Dwarfs with respect to space missions, but certainly out of the scale of what most investigators have capacity for. So I thank you for your attention. I plead for any advocate, be it in Congress or anywhere else, to help further these innovative fronts and exploratory means for helping these kids and their families in desperate need. Good morning.